I have been involved with the virtual reality program since the very start. A few years ago, we contacted Alienware and got all this equipment that you see around us.
So the lab actually began in 2017 when we were able to get a partnership with Alienware, which is a subsidiary of Dell. Some of the kids in the class initially had said that they had had physical therapy and that it was really difficult. And there was some interest that organically happened within the class about could we work with a pediatric rehab. So I said, well, we just have to reach out to the pediatric rehabs in Atlanta, and we decided to start with Children's Healthcare of Atlanta.
We decided that we were going to help the children in there with their rehabilitation program and their PT program.
We reached out via email to Children's Healthcare of Atlanta's pediatric rehab, and they actually returned our email within about 48 hours, and there was interest in that.
First off, we went in, we saw what the children are actually experiencing, and we decided to make a beach that has a carnival on it to distract the children from the pain.
We finally got our full prototype done, and so we brought it to CHOA a couple weeks ago, and we actually got the project out. We had to work on all this equipment, find the best equipment that would actually work for the patients and what's the best to bring to the hospital throughout that process. So we finally figured out what we were going with, which is the Oculus Quest.
Some of us went in and we actually tested the equipment out, designed an experience based on that, and then I built it.
What's really unique about this process is that the main group of students who created this first prototype 2 years ago were still with us. So we're all still the VR team.
When we went to Children's Healthcare and actually started testing the experience on patients, it was really just amazing to see their reaction to the different experiences that we had built. Some patients were just happy to walk around and lounge on the beach. Others wanted to try the rock climbing wall or ride on the Ferris wheel. And there were even people that were shooting basketballs and helping with their motor skills, their walking, and anything in between the entire time. So far, they're very excited to partner with us, and I'm really glad I was able to build this experience for them.
So the next step at CHOA is we want to keep our partnership going and going and going. So we want to keep on interviewing patients and try to make our product the best it can be. We want to keep on adding to it and trying to figure out what's not good, what's not working, what can we do better. And we want to keep on doing partnerships with them just because we can make this so big and so broad that it can be used in rehabilitation centers, it can be used right after a surgery, it can be used in many different parts of the hospital besides the rehabilitation center.
I think it was a moment of being not only a teacher, but someone who has watched these students grow and become more and more empathetic. It was just, it was a magical moment as an educator and just as a human being to see somebody's pain lessened and them doing more of what is good for them because of a product that our students created.